All right, I think it's exact time. It's exact time that we start our panel session today. Oh my god, I'm super excited to see everyone here present. All right, good evening from my end, good morning, and good afternoon from your various locations. Once again, welcome to this first ever panel session by the Compassionate Pharmacy Practice Project. You're all welcome. Welcome, Dr. Opara Joy. Welcome from Taiwo. Welcome, Pharmacist Omotoyosi. Welcome, Pharmacist Blessing Inyang. We are glad to have you all here. My name is Ubiere Basi, and I will be your moderator for this event today. I won't be doing this alone. I'm here with my co-moderator by name Abola Adebayo. Please, Abola, are you here with us? You can say a word or two.
Yes, I'm here with you. Good evening, everyone from my end here. Good afternoon, good morning from the other locations. So I'll be the one moderating alongside with Ubere this evening. Thank you.
All right, thank you very much, everybody. Thank you. Though we had some issues on your network, but we hope it to get better. All right, so moving forward, we just go straight to the agenda for today. And first on the agenda for today's program is a welcome address by the founder, or should I say the CEO of the Compassionate Pharmacy Practice Project. And that's the person of Miss Ruth Adeyemi. So please let's give her our undivided attention as she handles this part for us for 10 minutes. Please, ma'am, you
All
have
right. Yes, I'm here. First of all, the title founder or CEO, that's yeah, let's not use that, okay? But it's good to have everyone here today. I'm really excited. This is a long-term dream. It's something that I've been working on for a long time, and it's good to finally see that we're starting something about this project that we have. And like I said in my email, I know that you have a lot of questions, about what is TCPPP, who are these people, what is this thing about. But first of all, my name is Ruth Adeyemi, and I am a student pharmacist. And TCPPP, just like Ubiria said, is the Compassionate Pharmacy Practice Project. And the goal of the project is to build a Nigerian pharmacy practice system where good pharmacy practice and compassionate care is practiced in every area, right, in Nigeria. Regardless if it's an urban area or if it's a rural area, we're still practicing standard pharmacy practice, right, in every area of the country. And our mission is to enforce standard pharmacy practice at all pharmacy levels and promote pharmacists as key healthcare professionals in the Nigerian healthcare system. Now, these are like big things and big words that I'm throwing around, and a whole lot of things are going to go into them to make sure that we achieve all of these goals. And one of the many, if somebody can like ensure that people are joining, that would be awesome, all right? But one of the many ways that we're going to be ensuring the success of this project is we want to make sure that the medications that we're getting as pharmacists, that we're giving patients as pharmacists, they are coming from the right channels, right? That's one of the ways that will bring the vision and mission to a reality, ensuring that pharmacists are getting enough compensation, right? Because if we are compensated enough, I'm going to use the term we, if we're compensated enough, we're more likely to do a better job, we're more likely to ensure that for good pharmacy practice is put in place, right? And making sure that we have the right assistants, yeah, making sure that we have pharmacy techs in place, you have a good ratio of pharmacist to pharmacy tech, upgrading our education system. That's a big part of this project as well, ensuring that patient safety is at the forefront of everything that we do. And we're going to ensure this by having like information sessions with student pharmacists and Nigerian pharmacists as well. And of course, respecting each other as pharmacists and having a respect for the profession as well is going to help us achieve this, the vision and the mission, and also making sure that we gain respect, right, from other healthcare professionals. That's a big part of this project. It's one of the many issues that, by the grace of God, we're going to work on. And policy changes as well that is going to affect us positively, because when it comes to improving pharmacy practice in the country, is beyond. We're starting from the grassroots with TCPPP, like with the Compassionate Pharmacy Practice Project, but then it goes beyond the grassroots, right? And you have like policy changes that we have, policy making changes that we have, policy changes that we have to make to ensure that we have solutions to all the issues that we're going to be bringing some of them up today, right? The panelists are going to be answering some questions today, and also aligning our mindset to understand our profession beyond the profit side of it, and committing ourselves to self-directed learning and advocating for our profession. So these are the many ways that we are going to bring the vision and the mission of ensuring that we have standard pharmacy practice, ensuring that Nigerian pharmacists are well respected, like other healthcare professionals, right? And for this panel session, that's actually one of our short-term goals. We have short-term goals for the project. We have long-term goals for the project. And one of the short-term goals is this panel session to figure out the issues that we're facing, the setbacks that we're facing when it comes to achieving good pharmacy practice in the country, right? And another part of that, right, to even dwell on that point, we're going to be bringing in, medical doctors. We're going to be bringing in nurses. We want to hear from them. Why are we seeing some of the issues that we're seeing where Nigerian pharmacists are not given the opportunity, or they're not trusted enough? We are not trusted enough to provide medication therapy management to patients. So we're going to be having these conversations and bringing in other healthcare professionals on board on these panel sessions as well. So I am telling you right now that this is just the beginning. This is not it all, right? This is just the beginning of the project. And one of our short-term goals as well, we're currently working on a research which is centered around confirming the issues that we know that are there. We know that there are issues in our pharmacy practice, but then as scientists, we want to confirm that these issues are actually there. So we've started the research planning process, and hopefully very soon we're going to have the paper published. And this will be like our leverage to talk to people in power and say, yes, we know that there are issues. We've confirmed that there are issues, and these are the probable solutions. And then we start to work our way towards policy changes, okay? And then beyond that, we have like long-term goals of being in the places and positions where the issues that affects us as pharmacists, where they're being decided upon, right? And that way, you're talking about politics, you're talking about being in regulatory positions. So in the end, this is not a today thing. It's not a 1 year, 2 years, or 5 years thing. It's a nation building project by Nigerian pharmacists to improve pharmacy practice in the country. And we need all hands on deck. It's not going to be a one-person thing. It's not going to be a two-people thing. It's going to be a collective effort, right? You that you're listening here today, I'm so grateful that you're here, that you took out time to be a part of this panel session, to ask questions, to listen in, to hear the answers that our panelists are going to be sharing around the setbacks that we're facing. And collectively, we can work together to come up with probable solutions, right, to address the setbacks and the issues that we're facing when it comes to pharmacy practice in the country. Like I said, the list is endless, all right? The list is endless. It's not a one-day journey. It's going to take some time. But I am ready for the journey, and I hope that you're ready for the journey as well. And one thing that drives this project, or the first why for this project was I saw how good pharmacy practice and compassionate care improved health outcome of patients, right, in the remote area of Ekiti State. And I've also seen the opposite. When GPP is not set in place, the negative effect it could have on healthcare, on our healthcare, right? So with this understanding, this project was birthed. And right now, my why is, when I think about this project and my drive for it, I think about the people, the pharmacists, Nigerian pharmacists that do not have the opportunity to leave the country and they don't have a choice but to stay in Nigerian practice. For those people, we want to make sure that they're practicing pharmacy the right way and they have all that they need, right, to ensure that GPP is put in place and they are all about patient-centered care, right? And I also think about patients that can't leave the country to get better health care, right? And for these patients, how do we make sure that we provide good and great health care for them, right? And like I said, once again, this is going to be a long journey, but it's a journey that we're ready to take, and it's a journey that we've started with you here with us today. So once again, thank you for joining, and I hope you're going to ask great questions to add to that centered around the theme of this panel session, which is the setbacks and the way forward for good pharmacy practice in the country. I also want to use this opportunity to thank our panelists for joining. Thank you for your time. Thank you for giving us some hours in your day. We appreciate you. I appreciate the good work that you're doing, in your respective areas of practice. And I hope that today is going to be a wonderful session. It's going to be an expose session, right? Where we get to see some of the issues that we're facing and we hear solutions that are already in motion and probable solutions that we have in place as well. And as these questions are coming in and answers are coming in as well, we are taking notes because, like I told you, this is a combination of research and an information session, okay? And it's for a greater good to improve pharmacy practice in the country. So once again, I know Hubir is like, that's enough. All right, yeah, because I could go on and on. But thank you guys for joining, and I trust that you will join us on this project because once again, it's a project by Nigerian pharmacists to improve pharmacy practice in the country. Thank you very much.
Thank you, Ms. Ruth, for that wonderful but very brief welcome address. So I think the next thing on our agenda is introduction of our panelists. Like here now, we'll be having 4 panelists, and we need to know little about them. So let me call it, and permit me to say, it's an autobiography because it was actually written by themselves. So we'll be introducing our panelists, and I think to start with that, I would like to call on Aremu Favor to do that for us. Favor, please, are you there?
Good evening, everyone. I'll be reading the citation of Dr. Opara now. Dr. Opara is a lecturer and the head of department, Pharmacy Technician Department, Edo State School of Health Technology, Benin City. She was the chairman of the Health Education Committee, PSN, YPG Edo State between 2019 to 2020. She's a member of the following organization: Pharmaceutical Association of Nigeria, Association of Hospital and Administrative Pharmacists of Nigeria, and Clinical Pharmacists Association of Nigeria. She's also a member of the following committees: Edo State Pharmaceutical Inspection Committee and Research, Documentation, Presentation, and Publication Committee, Edo State Chapter. Dr. Opara is a young pharmacist, an entrepreneur, passionate about learning, making a difference, and impacting lives through education. Can we make welcome Dr. Opara with a clapping ovation in the chat box?
Okay, thank you, Favor.
All right.
Next here is Pharmacist Taiwo Olawehinmi. Pharmacist Taiwo, she is an emerging global health pharmacist with an interest in health financing and policy making in Africa. She was one of the 2 Nigerians selected for the West African Young Leaders Fellowship in year 2020. In recognition of her leadership potential and passion for Africa, she is the co-convener of Pharma Incubation Hub, a career accelerator for pharmacy students across Nigeria. Her interest in policy making led her to model United Nations conferences and ardent monarch. She has co-chaired various MUN committees within and outside Africa, including World Health Organization, the United Nations Security Council, and the Social, Cultural, and Humanitarian Committee. She currently works with Advantage Health Africa to transform the retail pharma ecosystem in Nigeria. Favor, over to you.
Favor, if you're speaking, we can't hear you.
I'm going on with the citation of pharmacist lesson now. Pharmacist lesson Inyang. I hope I pronounced it well. She's a pharmacy graduate from the University of Uyo. She's passionate about career and professional development. She holds a diploma in addiction medicine and care and is satisfied in safe prescription from the University of Beatrice, Columbia. She's a graduate of the Global Health Emerging Leaders Program, an antibiotics steward, and a certified community immunity ambassador by Mohammed bin Rashid University. She was the former director of academics and the program coordinator for Drug Compendium, where she organized weekly radio health programs. She also attended conferences and seminars that have broadened her knowledge as well as shaping her perspective on the profession. She interned at St. Luke Hospital in Akwa Ibom State, and she's currently working as a community pharmacist at Bicam Healthcare Limited, Uyo in Akwa Ibom State. Can we make welcome pharmacist Blessing with a clap innovation in the chat box too?
All right, thank you, Favor. And the last person on my list, I think when Ubiri wanted introducing Miss Ruth Adeyemi, then she said the founder and the CEO. So next on my list is also a founder. She is a founder. So I have a pharmacist, Omotoyosi Olariwaju. Pharmacist Omotoyosi Olariwaju is the founder of the World-Changing Woman and superintendent pharmacist of Flazer Pharmacy and Stores, Ilorin, Kwara State. I think that's my state, so she should be someone I will know very well. She is the health outreach coordinator and member of the support team of the Kayode Adamolekun Foundation, the project coordinator and team lead of the Power Health monitoring team, and the pharmacist at the Well Woman Clinic. She was also the Kwara State coordinator of the Digital Health Corps. Whenever she is not in the pharmacy, she is either actively volunteering with the Kwara State Government Ministry of Health, Department of Public Health, or offering pro bono pharmacy services at outreaches. For her, there is no dichotomy between the secular and the spiritual, as she loves God and dedicates all achievements to Him. She is a devoted Christian who loves prayer and music, just like I do. Thank you.
Thank you very much, Debayo and Femi Aremu, for that beautiful reading. I'm sure we now know who our panelist is now. So we are eager to listen to this beautiful, seasoned, experienced pharmacist. And so we're going to just start right away. I hope our panelists are all ready for us. All right, so we are just going to move straight to the business of the day. First of all, we are going to be interacting, and at a point we'll pause. Then our listeners, our participants, will also have opportunities to ask their own questions as well. And please, very importantly, so that we can have a smooth running of this event, please, we implore that you please mute your mics when you are not talking, so that we can have a smooth running of the program. Thank you very much. All right, so moving forward, we are going to look at the first question that one of our participants asked. Now, this question, we are actually going to direct it to Pharmacist Blessing Inyang. Pharmacist Blessing Inyang, I hope you are with us in the program today.
I'm
sure you're there.
Yeah.
Okay, welcome, Ma. We are very happy to have you here today.
I'm very glad
All right,
to be
so
doing
a lot of
this.
people.
Go
Welcome.
on.
A lot of people have been having. Okay, a lot of persons have been having concerns about community practice in Nigeria, and we also understand that you have been practicing in the community sector for quite a while now. So we believe that you'll be able to give us a very satisfying answer to this question. Since the community pharmacy practice seems to be the most ventured into pharmacy practice in Nigeria, what key challenges are commonly faced in this sector of the pharmacy profession? What key challenges can you share with us are commonly faced in this sector? Pharmacist Blessing.
Okay. It's actually a fact that community pharmacy is the most ventured pharmacy practice here in Nigeria, because I think the community pharmacist best fits the pharmacist's definition of being the most accessible healthcare professional. So, I mean, anyone can easily walk into the community pharmacy and request for health and request for drug information. So that makes it everybody wants to get in there, like have a say about, like really be known as a pharmacist. It really fits the pharmacist definition of being the most accessible healthcare professional. And then here we have a lot of challenges, some challenges that I really want to, like the major challenges I really want to highlight here. We encounter challenges like the issue of fake and some substandard medications. Okay, yeah, most times the issue of fake and substandard medications, we still have drugs, substandard medication in circulation in the market now. And then you find out that this issue makes the prescriber, makes the physician stick to a particular brand, a particular branded medication. Meanwhile, they are supposed to be prescribing generics. Because we have brand names, we have generics. So the issue of fake and substandard drugs makes them to really stick to a particular brand. So when you try convincing the patients coming to purchase a drug and telling them, oh, we have other suitable brands that can fit in for a particular brand, and then you convince them and give them a particular medication, they come back telling you, oh, this didn't work for me, I have my particular brand. And the way, so you may just realize that this may not actually be a standardized medication. This wasn't the standard. Maybe something is shorting and a whole lot of discrepancies. So what I'm saying is that we have the issue of fake and substandard medication is a very big challenge here in the community pharmacy. We are not sure what is actually in circulation, and then most times most of these medications don't even have NAFDAC numbers. The National Agency Food Drug Administration Control, they are not really, like enforcing most of these industrial companies what they are really doing. So the issue of fake and substandard medication is a big challenge here. Another thing is poor regulation. Another big challenge we have here is the issue of poor regulation, poor drug regulatory systems in Nigeria. So the situation here in Nigeria is that aside from the pharmacy, drugs can be sold anyway. Yes, it's a sad reality. Drugs can be sold anyway. You can see people selling drug. The pattern medicine dealer, yes, sells drug. Even in the supermarkets, they sell drugs. You see triple action creams being displayed commonly in the shelves. Sell drugs in the supermarkets, even at car parks. Drugs can be sold virtually anywhere in Nigeria. So it's people still patronize them. It's no longer a matter of buying drugs from learned people, buying drugs from who is experienced, who has first-hand information about drugs. People patronize these people because they offer these products at a very cheap prices. Yes, they offer they sell this medication at a very cheap prices, both over the counter medications and prescription only medication. So you find out that people no longer they are just patronizing them because it's at a very cheap price. So they go to them and then buy this medication, use them. So it's no longer a matter of I'm going to buy drugs from this person because he knows the right drug to give me, or he knows the right dosage of the drug, or it's a matter of let me buy from them because it's cheap, it's affordable. So irrespective of the fact that it's effective or it's substandard or it's fake, they get these medications from them. And then we find out that we are actually competing with these guys. We are competing with these people to sell our drugs to. Yes, the community pharmacy here is also competing with them. We find these people, the supermarket people, the pattern medicine dealer as our rivals. We are competing with them. And that is a very big challenge here in the community pharmacy practice. And then
Wow.
moving forward, I have another challenge to bear. So moving forward, another big challenge we often experience is actually amongst us, is an internal problem. Like you said, that the community pharmacy is the most ventured pharmacy practice here in Nigeria. Yes, a lot of people want to go in there. They think it's the most lucrative this thing is the most lucrative aspect of pharmacy. So a lot of people venture into it, and then most of them they fail to make some basic realistic goals as pharmacists. They just feel, oh, it's all about stocking and the stocking of medication, buying from wholesalers, stocking, marking up, making profits, and a whole lot of that. So you find out that most of them don't have a realistic goal. They don't really have this idea of managing their the inflows and outflow of their finances. They don't even know when those kind of basic knowledge about business, because yes, community pharmacy is a business practice. You really have to, it's about selling drugs, making gains, making profits. But most time people don't really know the basics of business. They don't really know when their sales break even, the number of sales they need to make to start making the real profit. So most time when they venture into this practice, they don't have a realistic goal, they don't have a realistic plan. In the near future, you find out that instead of appreciating going forward, they are rather moving backward. The business plans eventually fails, and that's a big failure on her. It's a big slap on her face. So as we are moving on, I will just be discovering other. That's the basic challenges, the most major challenges in the community setting here in Nigeria.
Thank you very much, Pharmacist Blessing. I think that's actually very self-explanatory. I mean, you just went straight to the point and let us know some of those key challenges. So we are very, very happy to know this. But before we move forward, actually, the course of our discussion today, we'll be talking a whole lot on good pharmacy practice. Good pharmacy practice. So I think it is very pertinent that we understand what good pharmacy practice mean as a whole before we even look out for ways we can actually adopt good pharmacy practice in Nigeria. So I don't know if pharmacist Taiwo is here with us. Pharmacist Taiwo, I I would love you to also to share your thoughts with us. What exactly is good pharmacy practice? Pharmacist Taiwo, she with us.
Okay, hello everyone. Good afternoon. It's a pleasure to be here today. All right. So, pharmacy practice is a broad field of practice anyway. So, I want to believe that when we say good pharmacy practice, we want to consider it clinically, whether it's in community pharmacy or in hospital setting. Good clinical pharmacy practice basically is one that is patient centered, one that utilizes the capabilities of the pharmacists and the pharmacy team in advancing patient care, especially in collaboration with other healthcare professionals. And we understand that there are different aspects of patient management, especially from the pharmacy perspective, beyond dispensing, encompassing patient counseling, and of course, follow up of patients to ensure that clinical outcomes are achieved. For us here in Nigeria, we wouldn't say that we have achieved or attained best practices in pharmacy practice, best practices in in the accomplishment of our roles as clinical pharmacists. I am not a clinical pharmacist. I should add, but I have worked in instances where I served clinically in a hospital and briefly in community pharmacy. Although I work in the community pharmacy space, I do not work as a clinical pharmacy on the shop floor. I work with pharmacies to manage their operations, their businesses, and help them to be more effective in their roles as healthcare professionals. And of course, from experience, seeing pharmacies that we have managed in my company across Nigeria, we understand that yes, pharmacists are clinically oriented, great. They know the stuff, yeah. But many of them able to translate that knowledge to effective patient care? Are many of them able to translate their clinical expertise and merge it, of course, with business acumen to be able to run your businesses profitably. Because in community pharmacy in particular, it is largely a clinical practice as much as it is a business. No clinically sound pharmacist would just want to offer clinical expertise and run into debts, right? You want to be able to offer clinical expertise to your patients and be able to, of course, run your business in a profitable and sustainable manner. In the hospital, yes, you want to be able to offer clinical expertise to your patients and, of course, work hand in hand with the other healthcare professionals, the physicians, the nurses, the laboratory scientists, and other healthcare professionals. In fact, interprofessional collaboration is also important in community pharmacy practice, especially where you've got a need to refer a patient to the hospital and you go out of your way to say, okay, I'm going to establish a relationship with a clinic, with a specialist hospital, because I want to give my patients excellent care so that when a patient who has diabetes comes to the pharmacy, I want them to also be monitored by a specialist who can manage their condition, or if it is hypertension or any other chronic condition. So in my own opinion, I believe that good pharmacy practice is one that is largely patient-centered, and being patient-centered will definitely involve utilizing your business acumen, ensuring that you work in collaboration with other healthcare professionals to ensure that therapeutic outcomes are established. And this goes beyond dispensing of medications. It largely also involves keeping patient records to ensure that you're able to work with such patient records to follow up on the patient's conditions, going out of your way, even beyond that first step of exchanging the medication for the money, to say, okay, if as a community pharmacist you've got a large number of patients who are nursing mothers, you don't decide to design a plan, a treatment plan, a management, a wellness plan for those nursing mothers because you want to offer care beyond the counter. You want to offer care beyond the medications that those nursing mothers have come to get from the pharmacy at one point or the other. You want those patients, those people to recognize you as an authority in the community. Yes, because a community pharmacist should be an authority in the community so that people 2, 3, 4 streets away from your pharmacy do not need to go too far in search of expert care. They can trust you as the authority on health in the community. So I believe that good pharmacy practice, when established, will enable pharmacists to be recognized without stress, without any fuss, allow pharmacists to be recognized indeed as authorities in healthcare, authorities on wellness, authorities on medications, so that patients can, of course, get the best care, so that other healthcare professionals can submit to the authority of pharmacists because they recognize the good work that we do. And it is only when we do the good work that we can achieve all of those outcomes. Thank you very much.
Thank you
Thank you.
very
Thank you very much, Pharmacist Taiwo. At least I think I had a very, very key word there that pharmacists should be the authority in the community, which means in few months to this time at least, I'll be an authority in my community. Thank you very much for that. So I think the next question should go to Dr. Opara. Please, Dr. Opara Joy, please, are you there with us?
Yeah, I'm here.
All right. Thank you very much, ma. I think
All right.
like we dive in a little bit into the research sector of the pharmacy practice.
Okay. Okay.
Ma, so the first question for you, ma, is do you think pharmacists are performing at their best in this particular sector of pharmacy practice, like in the research
Not
sector,
at
ma?
all. Let me just be
So,
straightforward. No, we
all right, ma. Then how can we move forward if we are not doing up to expected?
Hello, I think your network is a little.
Hello.
Oh,
What you
all right.
said?
Or should I turn off
Sorry, ma.
my video? Let
Still,
me turn off my video
okay.
to see if that will help.
All right, ma. Please,
Hello,
are you
can you
with me,
come
ma?
again? I missed. what you
All
said.
right, ma. Since you said we are not where we should be, right?
Yes, we are not at our best right now when it comes to research as pharmacists.
Okay. All right, ma. So how can we improve moving forward, ma?
Okay, before you talk about moving forward, you need to understand what the setbacks are when it comes to this aspect we're talking about. So first and foremost, it is the problem for me, in my own opinion, is that starting from undergrad, that's why we're in pharmacy school, the concept of research was, it seemed as if it is for those pharmacists who are specialists in research or who specialize in research in particular fields they are, such as in academia, or in industry, or maybe in research institutions like NIPRI, Nigerian Institution of Pharmaceutical Research and Development. And so those of us practicing in other areas, maybe in hospital, in community, administration and the rest, research, that concept of research is alien, or it seems as if, okay, no concern me, that, let me put it that way, our own. But if there could be a reorientation, because there's a big lacuna, there's a big gap. Research is supposed to be an active process taken in every sphere of pharmacy practice. It should not be restricted, it shouldn't be restricted to those in active research fields. The hospital pharmacist has a very important role to play in your environment, wherever you're practicing. Research should be ongoing. Okay, I will give you a little example. I remember very well when I was an intern in University of Benin Teaching Hospital here in Edo State, Nigeria. I was opportune and privileged. I really thank God I had the opportunity to work with the then preceptor. She loves research. She loves, and she keeps emphasizing it. Research, document. As you're working, document pharmaceutical interventions. These are bases for research. These are things that can be used to make policies later. Just keep writing, keep documenting. When anything that is not documented is not done. That is a form of research. And I remember when she was carrying out a fellowship program, because of my interest, personal interest in research, I met her and told her I would like to be part of whatever she's doing in her program, and she took me in, and I was privileged to assist her with taking some very important aspects of research in the hospital setting, where after each day's work, I stay back and I begin to dig into prescriptions that have been prescribed for years, like a retrospective research. We have this store of research of prescriptions, where we go back to start investigating prescription patterns, medication errors are detected, and other things, like a retrospective and view as a way to profile how we can in the future, and how the role of pharmacists come into the limelight in that aspect in hospital setting. So even in the community pharmacy setting, research can be carried out. There are so many things going on in the communities, like the first panelist mentioned. Community pharmacists is the most accessible healthcare personnel in the community level. There are so many issues going on. There are so many things going on at the community level that could be documented. And let me give you an example. Say, for example, let me talk about contraceptives. Okay, there is this contraceptive use pattern, which is not documented, for example, but as a community pharmacist who is interested in to go into research, you decide, okay, let me take down data. Let us find out from our gathering of data which particular age group of people or females are use certain contraceptive more, which contraceptives are used more, and why, what could be the factor responsible. These things can drive other researches that can lead to coming up with certain factual findings that can promote the profession. So the fact is, if you bring it bottom line of everything, there is need for continuous orientation and reorientation of pharmacy students starting from pharmacy school. And for those of us that are already out there working, they need, maybe through our different technical group meetings, various seminars we go for, and in conferences, when we have yearly conferences, they need to keep reiterating the importance of carrying out, no matter how basic that form of research is, there's a need for us to let's ask questions. Why is this happening like this in my practice area, and why not like that? Keep records, write, document. It may not be used now, but in the future. But when there's no data, there's nothing written down, then there's nothing to investigate. You can't do any form of research. So that culture of documenting is not in us as Nigerian pharmacists. I can tell you that. I sincerely know that. So we need to imbibe it at undergrad level, and those of us that are already practicing, we need to continuously orientate and reorientate our minds as to the importance of doing one form of research or the other. Even though we are not in research institutions, we can be researchers in our very field of practice. Thank you.
Wow.
Permit me to add to what Dr. Joy just said. Yes, indeed. Even though we can't all be researchers, we can all be research oriented in whatever field of pharmacy we choose to practice in. And that's very true, very true. Aside the fact that we need to document, we need to embrace that documentation culture, I think it is also important that each person takes on a growth mindset and a self learning mentality. Yes, pharmacy school may not be able to include a robust research course in the curriculum. We've got loads of resources out there. There are online research courses that one can take, either as students or practicing pharmacists. I, for example, am currently enrolled in a research class because I want to build my research skills. So as much as we say that the pharmacy curriculum should be reviewed to include a research course or program, each person should take on a self-learning mindset. There are loads of materials online that we can learn from. We've got great student researchers and pharmacists who are researchers that we can learn from. Research is a skill and should be learned. So we should take on that self-learning mindset to harness the materials out there, take courses, pay for classes. I paid for the class I'm currently enrolled in. So pharmacists should choose to invest in themselves. I know that as much as we say, oh, we need to do this, we need to do this, very few pharmacists invest in self-learning. I know the number of courses I have paid for this year because I want to build my mindset, because I want to be more than the average pharmacist. I want to be a pharmacist difference, and that comes at a cost. And I hope that those of us who aspire to be trailblazing pharmacists will begin to count the costs and invest in building ourselves to be the pharmacists that we so desire ourselves to be. Thank you.
Well, that was a very interesting one. Key points: everyone, no matter your area of practice, should be involved in the research. So I'm super excited to hear this, and I'm sure we are learning and will do more in this sector of the pharmacy profession. Let's also dive a little into the hospital pharmacy. Pharmacist Omotoyosi, I hope you are here with us.
Yes, please. Good evening.
Okay, welcome, ma'am. So, pharmacist Omotoyosi, please. We know that the hospital pharmacy is another intriguing sector of the pharmacy profession. That one is actually very sure. So, what major setbacks do pharmacists face in this sector of the pharmacy profession, and what can be done moving forward to eliminate, if not totally, or to handle this problem, if not totally eradicate this problem that pharmacists face in the hospital pharmacy?
All right, thank you very much. Good evening, everyone. Good evening, Rose. Good evening, Taiwo. So good to see you again. Good evening, Dr. Blessing and Dr. Joy. Yes, so hospital pharmacy is one very important aspect of pharmacy practice. And yes, there is a problem in that sector, so to say. So, first off, I would like to take it one after the other. I have practiced in a government setting before, and I have practiced in a multi-system private setting before. So I could actually see the difference, and I found out that apart from the limitations that the curriculum of pharmacy school sort of has made pharmacists to have, there is also a shortage of pharmacy personnel in hospital pharmacy, in hospital practice. We do not have enough personnel. We do not have enough pharmacists to what's the word, to handle the what's it called, the number of patients that we see on a daily basis. I used to make a ratio, and it's just what it is. Yeah. So there's a consultant for almost every area of medicine. There's a consultant. That consultant has SR, registrars, copper doctors, and doctors on housemanship. And they see all these sets of persons, see patients, different patients, and they expect that just one pharmacist is going to attend to them. You understand? So they come down to the pharmacy, apart from the rigors that they've gone through in trying to see a doctor, especially in tertiary health sector, where it is very tiring, it's very tedious. By the time they get to the pharmacy, the patients psychologically, they are angry, they are off, they're not even interested in whatever what you have to tell them. Yes, so they just want to collect their medication and leave. And at the same time, the pharmacist too is looking at the crowd of patients that he still has to see. How can this pharmacist now sit down and start educating each and every one of them on this is how you're supposed to use your medication? Or is there a piece of information that the doctor missed out? And that's one difference between hospital and community pharmacies. When a patient comes into the community pharmacy, for example, apart from the fact that your community pharmacy and your pharmacist and you're trying to do one or two, you have time to sit down and school that patient, ask that patient questions, be able to take the medical history of that patient and be able to, okay, why is this happening, and be able to maybe sometimes question or maybe add an adjunct to whatever treatments that the doctor is giving. But in the what's it called, in the hospital setting, so to say, the only thing that gets to the patient, to the pharmacist, sometimes is just your prescription. And when you're even trying to sit and school the patient is uninterested. Why are you schooling me? Please just give me my drug. Doctor already told me how to use it, blah blah blah. And they just want to leave the hospital premise, which is not exactly the best in the interest of that patient. I've worked in another system before where I had access to the electronic medical record, AMR, of my patient. So whenever my patient comes into the pharmacy, you are able to go through the patient's EMR, able to go through the patient's medical record. So if the doctor is missing out something, you can call the attention of the doctor. Oh, doctor, please, you missed out this detail. Yeah, that's like collaborative practice. That's the pharmacist working together with the doctor. But in many hospital settings that we have in the country, we do not have that access. We do not have access to patients' records. So we cannot even, you can't question what you don't know. You just see the prescription and you can just do what you can do with that prescription. With the patient person even ready to listen to you. On patients that are on admission, on the whole, pharmacists being interested and being concerned and having a say in making medical and medication decisions for our patients. I've actually related with a few doctors here and there, and they will tell you that, I think Taiwo could testify, because I think me and pharmacist Taiwo, we finished from the same place, and we've been on ward rounds before where the consultants will tell you that you cannot come to the ward where I am working. Like, how many years experience have you gathered in learning this thing that will make you want to come and give advice or contribute your own quota, so to say, in that regard? And that brings us to the curriculum that the BPharm curriculum around here, I think, is different for some other persons. But for us here, we have the BPharm curriculum, which is quite limiting, so to say. So it makes every pharmacist know everything about every medication. Do you understand? And the excuses that the doctors want to bring on board is that, oh, we've taken a number of years to study just this medical condition and we are experts in this medical condition. You are experts in drug therapy, but you do not have like the knowledge, adequate knowledge on this disease condition, so to say. Yeah. So the problem about pharmacists not being enough, if at every induction ceremony that I have attended in my years in pharmacy school and at my own induction ceremony, one thing PCN representatives will always say is that we do not have enough pharmacists in the country. And if you look at the ratio of pharmacists to the population that we have in the country, it's very appalling. Yeah, and even amongst this, some pharmacists are finding their way out of it. Now we have the old Nigerian system where we're not even employing. Now we have pharmacists that could actually want to work in hospital setting, but the government is not employing them because they're like, oh, we can't pay for extra pharmacists. Maybe if we have more pharmacists, maybe if there's a pharmacist on each floor, maybe if there's a pharmacist in every department. Some teaching hospitals have different departments, cardiac pharmacy, renal pharmacy, pediatric pharmacy. Maybe if we have enough pharmacy, enough pharmacists in these tertiary institutions, and these pharmacists can like major in whatever unit they are in. If there's rotation, if there's no rotation, oh, I'm in cardiac pharmacy, so I'm an expert in this field. Maybe we will not have this problem. Maybe if the health system generally, not just the pharmacy practice now, maybe if the health system was better, if everything was as the world is going digital now. Everybody's doing IT. Yeah. So I think it's easier for hospitals that use EMR for pharmacists to be able to access the EMR than for hospitals that still use the old and faithful case notes. Because how many case notes do you want to carry? Do you want to transport the case notes from the hospital, from the ward? Do you want to transport it to the pharmacy and all of that? So it's not just the problem, that the limitations that we're faced in hospital practice is not just about the profession in itself. It's also about the health system in the country. Yeah, I think that's all I have to say on that.
All right, thank you, Pharmacist Omotoyosi. I think I picked something very, very important while you were talking. You said the PCN registrar do repeat it that we don't have enough pharmacists. I think I was opportune to attend the last induction in my school, and he said the same thing. Then I kept on wondering that why can't the school try and induct as many as possible? Though I realize it's not possible to just induct them all. Thank you very much, man. We're very grateful. So I think the next question should be for Pharmacist Blessing. Pharmacist Blessing, please, are you there with us?
Yes, I'm following.
All right, ma. So the question is actually, like, let me say, something concerning community pharmacists also. So I have a question here that, though many people believe that pharmacists in the community sector are notably underpaid, is this a valid opinion?
Okay, on that page. Okay, if we
And
want to go that way,
yes, on ma,
continue.
let me just add here let me just add something else before you proceed, ma.
Okay.
All right, ma. And so if that's actually a valid opinion, they have another one here that says, as the wages earned by community pharmacists contributed to a poor pharmacist patient relationship, has it in any way affect good pharmacy practice in Nigeria?
Okay. The remuneration here in Nigeria is actually poor. If you want to compare in relation to other countries, we could say that pharmacists generally are not well paid comparing to other countries, as the case may be. But here in Nigeria, we are trying to step up, get some way when it has to do with the issue of payment. Like in some states, in the community setting, in some states we have a kind of a paying scheme set up by the Young Pharmacists Group, by the Pharmacist Society of Nigeria. They come together in collaborative terms to set up a kind of paying scheme where depending on the career, the cadre of the pharmacist, say a student pharmacy, an intern pharmacy, a corporate pharmacy, a post-intern or a pre-intern, we now have a kind of paying scheme that is what should be obtainable by this kind of people that wants to work as a community pharmacy. And this has actually helped with the payment issue, with the salary issue. Although this is actually in progress, not all states have actually embraced this. Like in my state personally, we have not actually reached there. So it's a matter of the pharmacists pricing yourself, striking negotiations so that you can be valued. You have to value yourself. And like Famti was said, be investing in yourself. So when you look at yourself and what you can offer, you'll be able to price yourself well. You'll be able to strike some negotiation when you want to pick up a community pharmacy job. Depending on what you can offer, depending on how you have invested in yourself, you'll be able to price yourself. You'll be able to know what you can actually gain, without having to wait for the pay scheme or wait for them to implement the pay scheme. So that is the case. But it does not have any negative effect on the patient directly. It's just that of course, if you are passionate about what you can, or about the patients, about the professionals who are rendering pharmaceutical care, you will not outrightly blame your poorly paid situation on the patients. You will not transfer your aggression of lack of good pay to the patient. I mean, you have to be considerate, irrespective of the fact that you are not getting enough in terms of finances. You also have to render good pharmaceutical care, because good pharmacy practice is dependent on the quality of pharmaceutical care we as pharmacy render to patients. So irrespective of the pay, okay, even though you are not actually paid well, but you just have to be passionate about what you are doing. It starts from the mind. You have to clear your mindset, be passionate about what you are doing, and then render the pharmaceutical care. It's only going to affect you negatively, because you will not be satisfied in the job as a community pharmacy. You lack motivation. You're not going to inspired. You don't feel your relevance if you are poorly paid. It does not really have a direct negative effect on the patient. It's only affecting you negatively because you lack motivation, you are not satisfied, and all of that. And eventually, you may eventually lay off the job and then find other ways, other suitable, other satisfying and fulfilling areas of pharmacy. Meanwhile, in the actual case, that is not supposed to be so. For example, now I have an interest in community pharmacy. So I'm looking for a job. I picked the interest of being a community pharmacy. So you may find out that at the end of the day, if I'm poorly paid, I may not really see my field as a lucrative venture. I may not really see my field of interest as a very lucrative one. So I may lay off my job and then look for other ways, look for other moves, even when that is not my passion, even when that is not my interest. So it only has an effect on the pharmacist individual, not on the patient. On the patient, you have to be passionate about what you are doing. You have to be passionate about the pharmaceutical care you are rendering to patients. Also, I will say it as a call to everybody, like a play, like an advice. It all starts with investing in yourself. You have to invest in yourself. You have to know what you can offer, so that even if your group, even if your the young pharmacist group, even if the pharmacist group are not doing anything about the paying scheme, you also have to put value in yourself. You have to invest in yourself, so that when you go out there looking for job based on your interest, you will be satisfied. You will be, so that even if anybody wants to pay you down or underpay you, you understand, even when somebody wants to underpay you, based on the value you can give, you will eventually find a suitable a suitable pay that fits you, and you then be able to render whatsoever care you are giving to the patient in a very satisfied and fulfilling way. So all I'm trying to say is that it all boils down to investment. It all boils down to the value you are giving to the patient. I mean, if you want to be a community pharmacist, it just goes beyond dispensing. You have to have a broader knowledge of drugs, the drugs, a lot of things. You just have to be up and doing, gain knowledge here and there, because you may not know. People are coming in house asking for health information, asking for drugs, and we have a whole lot of drugs. New drugs are coming in. You have to be versatile, you have to be updated, your knowledge has to be updated, so that whatever the case may be, based on the value you are giving yourself. If you are a poor community pharmacy, definitely you'll be underpaid, because if you are not putting up good value, whosoever that employs will be so disappointed, and you will be underpaid. It all boils down to be investing in yourself, personal development, career development, or professional development. All of these steps has to be upgraded, so that you can fit in with the current paying scheme, and also be able to strike your own pay and be properly paid.
That's thank you very much, my sister Blessing. I think we've picked a lot of points. Personal development is part of it, and also you shouldn't talk actually how to transfer your aggression, or maybe because you're not community pharmacists in general are not being paid well, then you should transfer the aggression on the patient. It shouldn't affect our patient pharmacist patient relationship. That's noted. Before we move forward, please. Okay, pharmacist Taiwo, you want to say something?
Yes, please. Yes, please. Thank you so much, Fam Blessing, for the incredible response you gave. I just wanted to add my bit to that line of discussion regarding pay. The
Okay.
the matter of pay for pharmacists, for young pharmacists, seems like a never-ending tussle. Everywhere you turn, from Lagos to Abuja to Kaduna to Kogi to Anambra, you find pharmacists complaining about the poor pay. You find young pharmacists complaining about the poor pay. And when you listen to pharmacy owners themselves, they also complain about young pharmacists. The fact that young pharmacists are unable to pull their own weight. They're asking for a whole lot. They're asking for money, yet they cannot deliver the value that is commensurate with what they are asking. I'm glad that we've got a number of pharmacy students here, and many of you will venture into community pharmacy. I do not want you to graduate from school thinking that because you are a pharmacist, you're automatically going to get loads of money because you're a pharmacist. It doesn't work that way. You are going to get loads of money if you've got loads of value to deliver, because money flows in the direction of value. If you want to venture into community pharmacy, you need to begin to think, what difference am I going to make in community pharmacy practice? I'm privileged to work with a boss who, yes, I'm currently in management and consulting. So she consults for and manages community pharmacy. But before she came into management and consulting, she was in the clinical community pharmacy space. I can tell you that she is one of the most phenomenal community pharmacists that I have ever met. Yes, she lives a baby girl life. She loves money, right? She loves the soft life. But you'll find that this person is not the money driven person, but the value driven person. I would hear with enthusiasm how she shared her experiences in community pharmacy, how a patient would stop at nothing just to be able to hear her consult for them. She would go to the physician's office to fight on behalf of her patient. Her patient took her word for it. She would design treatment plans for her patients, her chronic patients with diabetes, with hypertension, with whatever conditions. She went out of her way to deliver value to the patients. How she wasn't the owner of the pharmacy, she was just a regular employee, and her salary wasn't so much, but she delivered value to her patients. Now, regarding the issue of pay, yes, I know states like Benin have tried to standardize pay, but we may not be able to get standardized pay across board because pharmacies differ in size, in ownership, in the kinds of people who operate in those pharmacies. We may not be able to get standardized pay across board. However, I can tell you that there are pharmacists who are well paid, community pharmacists who are well paid. My company recruits for community pharmacies as well as management and consulting for community pharmacies. So yes, I interview pharmacists when we have to recruit them. And I get to make a decision on whether a pharmacist should be recruited or not. Yes, when I ask business related questions, clinical questions, operations related questions, I can test the capabilities of that person. And if I see that you're not worth it, you're just for the money, you will not get employed. If I see that you're able to defend whatever you're saying and you're able to bring value to bear, why not? Now, all of us studied pharmacy in school, right? Every community pharmacist studied pharmacy in school. What's going to differentiate you from the other community pharmacists? Are you going to be merely dispensing medications? What extra value are you going to deliver to the pharmacy and to the patient? I should tell you that when you think of delivering value to your patients, money will come. The pharmacy will increase in sales. Your pharmacy owner will never let you go. In fact, when you decide to tender your resignation, the pharmacy owner will beg you to stay. The pharmacy owner will try to reach a consensus with you. Or do you want your salary to be increased? What can I do to make you stay? Some pharmacies have never remained the same because a pharmacist, a great pharmacist, left that place. So when you think about community pharmacy and wherever you're working, think about your absence in that place. Will your absence be felt? I attended a health tech event yesterday for industry leaders in the healthcare sector, and I moderated a panel session for healthcare leaders. And I met a pharmacist there. She is the MD of one of the most reputable pharmacies here in Lagos. And she brought up the same issue. She is currently the PRO of ACPN Lagos, Association of Community Pharmacists in Lagos. And she was telling me that she was decrying the situation. of having young pharmacists who are unable to deliver excellently in the workplace. She gave an example of a local pharmacist who was working in a pharmacy. The person would be at the pharmacy pressing his phone, doing absolutely nothing, not at the forefront of the pharmacy, but going inside. You are the pharmacist, for crying out loud. What are you doing in the store, in the inner room of the pharmacy? Shouldn't you be at the counter attending to patients or anticipating their presence in the pharmacy? Even if patients are not walking into the pharmacy, shouldn't you be thinking about how to generate customers, foot traffic for the pharmacy? Now, when patients walk into the pharmacy, the healthcare assistant then walks inside to go and call the pharmacist. Is that what you were employed for? Do you think the pharmacy owner would even want to increase your pay for that? When you think about community pharmacy practice, begin to think about how you can rethink the current status of community pharmacy in Nigeria. What value are you going to deliver to the table? Because money surely flows in the direction of value. Thank you.
Wow, pharmacist Taiwo, that is actually very, very straight to the point. I think I've gotten two things: building value. Once you have loads of value, then loads of money will come to you from what you just said. So it all boils down to building. But what can you offer? I think that will be able to determine your pay. That will be able to determine how much you are going to earn. So I thank you very much, pharmacist Taiwo, for bringing that to play. We really appreciate that. So I don't know. Let's now let's turn attention to the audience, please, so that do you have any question to ask the panelists? I mean, you can direct your question to any specific person, or you can make it general. So if you have any question for the panelists, you can just show by a lift of hand, or you just unmute your mic and then ask your question. That's for the participants. Please, if you have any question for a particular panelist or general question, you can just unmute your mic and ask your question. If we don't, then we'll just have to move forward. Okay, we'll just give like a minute for that. Anyone?
Hello, good evening, everyone.
Good evening, welcome.
Yeah, yes, thank you so much, Pharmacist Taiwo. Yeah, well said. You have to deliver value to get the money, but we also have to. I believe we have an obligation to balance both sides of the coin too, because some community pharmacies can be totally inhumane. Totally. I'm sorry to say that I'm saying that. I'm not saying it by cooking it up.
Sure.
These are things that we have seen. So some of us here have seen. Some of them can be totally inhumane. They are just about. Some of them are just about the money. They are all I call money mongers. Though there are some of them that they are reasonable. They will pay you and they will treat you with dignity. Some will even when we're in the search for internship, then a friend of mine resumed that a pharmacy in Lagos for internship. Though the pay was okay, but believe me and you, the job description was more or less like that of a sales boy, not even a rep, a sales boy. He was doing the job of a pharmacist. He was doing the job of the cleaner. He would be the one to clean the shelves. And that's what normally an attendant should do. A pharmacy store should have an attendant, someone that will clean the store, someone that will do all those menial jobs, not trying to relegate those people or to belittle them. It's their job. It's what they do for a living. So there is what they call dignity of labor. It's what they do for a living, but that's not the job of a pharmacist. So how will you pay a pharmacist in 110,000 naira per month and be telling the person to clean the shelves early in the morning in what coat, in your lab coat, you'll be the one to clean the shelves. So I think there are some things that are totally unacceptable that some community pharmacists do. I'm not trying to bring in some moral code into this thing or trying to make a moral argument. But some things doesn't just make sense. And that's the fact. I'm not trying to say I will end up most likely owning a community pharmacy in the future. Many of us here will do, but I just believe I hope we'll be able to change the narrative. In Nigeria, people don't even follow labor laws. We have a law. We have a law that is controlling labor in Nigeria, for God's sake. Some of these guys don't even follow labor laws. They just treat workers like slaves. So I will be charging also because this is a room of almost 30 people. I believe at the end of the day, many of us in the near future will be owning community pharmacy. So I believe we treat people with dignity, with honor, and treat them as pharmacists that they are, not like sales boys. So I think it's important. Though I know there are some people that they don't take their job serious too. So if you are not taking your job serious too, if you are fired, then you cause it. But we should also look at the other side, of which the power is tilting more towards the community pharmacists because they are the boss. So there is no the power is not balanced. So they have more tendency to be dictatorial. They have more tendency to abuse the power because they have more power. Yes, the boss has more power over the employee. So they have more tendency to abuse people than the intern or the local pharmacist or the full-time pharmacist working under them. So we have to be very careful too. So some of them will just play lip service to it. They will say money follow value, of which they expect you to do a lot of work. Some of them even expect you to do the unimaginable. The place is understaffed. They will be expecting the few staff to do what, like, they were expecting 5 people to do what 10 people will do in a way to save more. At the end of the day, they will go out and be saying money follows value. That's not true. You have to employ many more people to really enjoy people too, to make them more productive and efficient. You don't expect one person to be doing what 10 people will do. So fancy, I understand where you are coming from. This is not like an attack or whatsoever. I just want us to balance it because I see there are a lot of young people, pharmacy students here. So they will not have the mentality that even when they are doing, they are the one doing less. So they won't this the idea that they are not giving value when someone is telling them to keep doing more and not like the pay will be getting better. So I think we should make sure in our own conscience do the job that is expected of us and make sure we are treated well too. So thank you everyone. Thank you so much. I just have to chip in that. Thank you so much. Thank you, Pamsi. Thank you so much. Thank you everyone.
Okay, thank
Could
you.
I
Can I respond?
to okay?
You want to
I will
respond?
do justice.
Actually,
Do
okay.
justice.
What you have a point. Yes, some I've heard stories of pharmacy owners mistreat mistreating, yes, their pharmacists. I think it's important for pharmacists to clarify expectations. So, what are the job descriptions? Because I operate in the retail pharmacy space managerially, we've seen that many community pharmacies are unstructured. So pharmacies do not have standard operating procedures for their processes. They do not even have operating procedures for recruitment of pharmacists or other employees. No offer letter, no clear-cut job descriptions, right? If you work in a structured environment like my company, we run a few community pharmacies ourselves. When you get interviewed, if you are selected, there is an offer letter with the pay and the job description. If you're fine with the pay as well as the job description, you sign and you come on board. If you're not satisfied with it, you express what your reservations are. If we can reach a consensus, we do, and then we move on. Aside the job description and pay and other documentations, I think that it's also important for pharmacists as employees to be able to communicate with their needs. What do they think they need to be able to perform their jobs well? If you communicate in an effective manner to the pharmacy owner and the pharmacy owner doesn't seem to understand what you're saying or doesn't want to come to terms with what you're sharing, you have an option to actually walk out. You have an option to walk out from a place that isn't serving you. we shouldn't complain about working in a place when we've got a choice to walk away. Many of us may not have such choice, maybe because there are not many options out there. I think we should also put in mind that you've got a choice to walk away from a place that isn't serving you. From TLC, please.
All right, so I'll pick it up from where I was stopped. I'm just going to be saying a few things, and I'll move. First off, starting, I'll pick it up from when Taiwo was talking about value. There is something in the curriculum of pharmacy that I think we don't pay so much attention to. I think it's taught in SAP or something, but they only taught us once, and I feel that it is something that we should continue to, to teach every other time, and that is the concept of the 8-star pharmacist. The 8-star pharmacist. The 8-star pharmacist is really a thing, but we do not pay close attention to it, and we do not really observe it in this, like, we're not even taught, because if you understand the concept of the 8-star pharmacist, you will know that you're not just supposed to be a dispenser. You know that one of the things that pharmacy entails is that you have to be a lifelong learner. You have given yourself to lifelong learning. You have given yourself to managerial services. So you know that it is not just about you being somebody that understands the drug. There are other aspects of being a pharmacist that we really do not touch up on so much so. Do you understand? And it makes us lacking in certain aspects. That's why you say that pharmacists are not very effective managers. I learned a lot from Vanguard Pharmacy. Vanguard Pharmacy is a pharmacist, but that man I feel like he can run for the president of a nation because of the training he has given himself to. And he constantly says it, 8-star pharmacist, 8-star pharmacist. Now pick it to the question that Mr. David asked. See, my brother, some pharmacist owners, yeah, the panel session. Exactly, very nice people. You understand? And that's why you should join the YPG in your state, because there's a red list. I think that's what's called a red list, or the red flag pharmacy.
Let's not say red list, because PSN will come for us and say that young pharmacists are ganging up against older pharmacists.
Because
in Lagos, I served as public relations officer of Lagos last year. So
yeah,
when there is a vacancy ad on if a vacancy ad is shared on the group page, people who are interested in the ad ask, okay, who has worked in so and so pharmacy? What were your experiences? What is the salary like? What's the work condition like? So you get to hear from people, the good, the bad, and the ugly, and you can make your choice.
Takes me to the point where found out that pharmacists do not ask questions. We do not ask questions at all. I don't know whether it's because we are shy, whether it's because we do not, I don't even know what it is. You just join you just take the job, you just jump on the offer, ask questions. The pharmacy profession is very small. You will know somebody that knows somebody that has worked there. It is not as if pharmacists change jobs very often. And so there's this particular pharmacy that always has a vacancy. Every month there's just what is making young pharmacists leave that particular premise. Do you understand? Aside that, we're having the issue of people that are not professionals who now owns pharmacies, non-pharmacists that now own pharmacies. They do not understand the concept of professionalism. And so they're the ones that come up with all manners of strange my dear, strange requests is very is common in the pharmacy practice, and it started from all these non-pharmacists. Do you understand? Ask questions, ask the people, sorry, what do you expect? Taiwo spoke about expectations. What do you expect that I do? What's my working hours? What's my job description like? Ask them, do you have a cleaner? Do you have a sales staff? Do you have a cashier? I've seen pharmacists that as sales staff. You're the one in the supermarket. You're the one collecting cash. You're the one. Do you understand? This is not why you are there. So ask questions. Ask your senior colleagues. Ask your employers. Ask a lot of questions. Number 3 thing that I would say, sorry, it's more than 3 already, is that don't jump at every offer. YPG in my side, we say that sometimes pharmacists act as if, I don't know, they are desperate or something. And so even offers that you hear, you say, okay, so what did this person tell you when this person wanted to employ you? And the person tells you, and you're like, okay, the person told you, why did you take the job? Because we're humans and everybody's not perfect. Do you understand? People have their own flaws, people have their own character challenges and all of that. So some people are not kind. Let me use that word. Some people are not, they're just not kind people. You understand? So they make ridiculous offers. They give you money. The package looks very good. It is now when you get into the system, you find out that actually you're doing 3 months job. That's why the money is this much. You understand? So please ask questions. Join your YPG. In Kwara State where I practice, job offers have to go through YPG. In fact, it's a big deal. I understand where Taiwo was saying that PSN will say that YPG just likes to do rishi. YPG Kwara does rishi. Do you understand? In Kwara State, they've been able to do this whole standardization thing. Yeah. So job offers have to go through YPG. So YPG by themselves scrutinizes the place, asks the basic questions, and make sure that the working environment for pharmacists is non-toxic. We would not come and say that, oh, it's perfect out there and all of that. We have some employers that are not the best. So ask questions, work with YPG, have a senior colleague that mentors you. Don't just jump, As much as you have academic mentors, have career mentors too, people that you can always talk to, ask questions. Oh, I got this offer. This person is saying this person is saying that. Do you think it's a good one? Do you think I should take it? Ask questions and always sign a document, please. Always sign, have an agreement. Taiwo said something about that. Always sign a paper, always have an agreement, always have something that you can always go back to, because people could be funny. Yeah, people could be very, very funny. So yes, I understand where you're coming from when you say that some pharmacy employers can be a lot. Yes, they could be a lot, but these are some of the things that you could actually do that will help you not to go through that kind of hardship in the profession. Thank you.
All right.
All right.
Thank
you.
Okay, please, to
Omotoyosi.
add to that, I have something to add to that. Okay. Community pharmacy is actually a versatile field of pharmacy. It goes beyond normal dispensing of medications over the counter and all of that. So before you take up any job offer, you should be able to strike negotiation with whosoever is employing you. You get to ask of the expectations, what is expected of you. You get the person to state his or her description of job, yes, job description per se, and then what is really expected of you as an intern pharmacist working there, as a locum pharmacist, or whosoever you are working as. So you get to know what is expected of you, what target is actually set for you, and then you work towards improving yourself. What are you going to do to get to reach more people? What are you going to get to bring more people to buy you? It's not just sitting and then coming, selling to people, and it's not just about that. You have to also build value so that you can get your targets, you can get whatsoever your employee is setting for you. Thank you.
Thank you very much. Thank you, Pharmacist Taiwo. Thank you, Pharmacist Omotoyosi, Pharmacist Blessing, Pharmacist David, and every other one that have spoken. So because of our time, I would have loved so that we'll continue this discussion, but we will have to be time conscious. So I think the next question should go to Dr. Joy Opara. Ma, please, are you still there with us?
Yes, I'm here.
All right, ma. So the question is for you. The question goes like this, ma. There has been a lot of controversies about the PharmD program recently introduced into the Nigerian university. What advantage does the PharmD program has over the BPharm program? And do they have entirely different job opportunities?
Mm.
Ma, do you get me right?
Yes.
I got you loud and clear. Thank you so much for that question.
All
In
right,
fact,
ma.
I remember when I was a student too, I was wondering, because I didn't really know there was anything like BPharm or PharmD. I just know I wanted to study pharmacy. And I got into pharmacy school in Uniben. I think it was when I was close to graduating, or I don't know, at some point during my studentship that I realized, oh, there are other schools that are training pharmacists too, but they are offering BPharm. In fact, do you know my admission letter even carried BPharm? But I graduated with a PharmD. At the time the admission came, I guess the PharmD approval had not come, but before I graduated, the approval had come fully for my school. So yes, I've been interested personally in understanding why do we have a dichotomy? Why is there like a difference in training? Pharmacists, not be pharmacists. So I think we all have a basic idea, but I'll put it straight. From what I've come to understand, there's no profession that wishes to be static. And in fact, in life, change is the only constant thing, and we should all embrace change as long as it is positive change. So the basic difference between the B Pharm and the PharmD training is based on their content in terms of what they have to offer the students that are trained that become professionals. The B Pharm training was purely scientific in content. How do I mean? Oh, laboratory work. We're always thinking about laboratory, and doing everything that relates to the drug itself, like a product-oriented practice. But that was obtainable many years ago. But with the growing change in the way healthcare is moving forward and in international best practices, for us to be able to help the patients better, because it's not just about the drugs. It's humans that are actually consuming the drugs now. So how are they faring as they take these things we are making, or that we are monitoring to ensure that we are making good quality products? But the person's taking them, since it's not food, these are drugs, and we've learned in school that all drugs are potential poisons. So we are interested now for the PharmD. PharmD is now clinically oriented. Okay, so let's go outside the four walls of the laboratory or of the manufacturing lab, or as it were, or where we dispense the medications. Let's have a real life interaction with the people that use these products and understand how it is helping them, how it is harming them, how it can be of help in ensuring that the right person gets the right drug, their treatment protocols are followed properly, so that we can reduce, we cannot completely eliminate prescription errors or medication errors, but to effectively reduce them so that we don't have unnecessary complications that arise from prescription or medication errors. So B Pharm is looking at the drug, the molecule, the product, but PharmD is a little step ahead, meaning in addition to everything that B Pharm entails, which is a scientific context, clinical pharmacy is now added. That concept of clinical care, clinical orientation is now what makes PharmD stand out, so a step ahead of B Pharm. So that's why B Pharm runs for 5 years in Nigerian universities, and PharmD runs for 6 years. And for 3 years, from 400 level, from my training, from 400 level, we do courses in clinical pharmacy down to final year. And in fact, almost 100% of all the courses we do in final year is clinical pharmacy oriented. So we are exposed to clerkship, we're exposed to everything that has to do with the real life situations where these products that have been made are actually being consumed by those who need them to get better. So that, like we mentioned, PharmD, doctor of pharmacy. Like I'll make reference to the conference that was held in 2001. It's a conference in line with what PCN wanted for upgrading the B Pharm curriculum to D Pharm. So that was in August 2001. There was a 3-day conference to really look at this matter, to why we need to move up from B Pharm to PharmD. And so the advantages of PharmD program was brought out at that conference. It's a very important information. I think I'll make some direct quotation. I'm going to quote the then chairman of Pharmacists Council of Nigeria, and Pharm Prof. F.B. Adenika, in the year 2001, when he was actually talking about the need for us to start thinking forward, moving forward, PharmD, upgrade to PharmD. He made certain things clear regarding the advantages that the PharmD program offers. I will just quote one of the statements he made. He said, the fundamental rationale for the PharmD is to move the pharmacist from a product-oriented to a patient-oriented practitioner. B Pharm, I'm still quoting him, B Pharm is gradually running out of relevance to emerging practice. The PharmD will better meet current and future needs. Then he highlighted that there are 3 core areas that PharmD program addresses, which B Pharm program does not address, namely patient care, secondly, drug monitoring, and thirdly, relationship with other healthcare professionals. So we see a PharmD pharmacist is more outgoing because you are communicating with people, not just the patients, even the healthcare providers. You are in a healthcare team, you're not just behind the scenes. You are actively involved in the care and management of patients and their medication therapy to ensure that they get definite outcomes that will improve their quality of life as the process of pharmaceutical care. So a PharmD pharmacist is a doctor of pharmaceutical care. And that will help us to gain respect as in our healthcare team. Because let me say the truth, they look down on us, others, especially the physicians. We all know it's not new. There's always a talk of war between pharmacists and physicians, and not just between us and them and every other person. I know they're always fighting people, and I don't mean that in any negative way, but the point I'm trying to make is for us to be able to be at par, so to speak, we need to be able to show what we got to offer clinically. Yes, they tend to be clinicians. We too can be clinicians. That's what Pharm offers. And as we are clinicians, it gives us this respect. Like, you can look down on me because you think, oh, I don't know anything about how patients are managed because I'm not in a clinical setting. But as a big pharmacist, oh, that is what I am there for. So, give it to me for a doctor of medicine, I'm a doctor of pharmacy. We are both doctors, not only you be doctor. So that gives the idea of relevance, our professionalism, it enhances our professionalism, and it also, there's a way it helps the public to respect us more. The layman out there do not really value pharmacists generally. I know when I'm in the hospital, for example, when I was an intern, because I'm not really in hospital practice, when I was an intern, I kept wondering to myself, that the patients, they will be calm. They will be calm when they want to see the physician. Even the physician is taking time, they don't have the mouth to say him, they complain. The patients wait for hours. Once they're walking to the pharmacy, they start shouting at the pharmacy. They start making noise. And I'm like, come on. So I think there's this perception as if pharmacists are just, give me medicine. But when we really incorporate the concept, the idealistic concept of what PharmD has to offer, the general population will come to understand our value. They will come to see that we're actually helping them get better. We are saving their lives because there are a lot of interventions we are actually doing, which they may or may not be aware of, but which they will definitely come to appreciate later on. And so there is a very important thing for healthcare, other healthcare members or members of the healthcare team to be reoriented about our role as clinical pharmacists or PharmD pharmacists as it comes to healthcare. So that's where going to the world, there won't be issues. In an ideal setting, a PharmD pharmacist has access to the world because you have business there. But a big firm, there's a basis for contending that with you. But if a PharmD pharmacist, yes, you have a training for that, you have a certificate that's for that. So it gives us advantage everywhere. The last part I'll just mention quickly is ideally, it's supposed to give us an advantage when it comes to salary. An advantage where a PharmD holder is supposed to receive more pay compared to a B Pharm holder if they are both working in the same setting. Ideally, why is it ideally? Because Nigeria, maybe they are ideally the way they work now. So like for example, I'm working with Edo State Ministry of Health, Edo State government, and unfortunately, even though I have the PharmD degree, yes, I was employed with a B Pharm certificate. There was no advert for PharmD. There was only placement for B Pharm. So I have both certificates, B Pharm and PharmD. So at the end of the day, my take-home pay is that for B Pharm. When we were to impute for biometrics, and there was a portion for me to impute what my qualification was, there was no option for PharmD. There was no option, it was for B Pharm. And even when the title doctor, there was no provision for that. There seems to be this system constraints we are having towards the PharmD. Many of the internal issues we are having towards acceptance, but the government, as it were, I don't know whether there are states that have really incorporated that, but here in the state, there's no provision for that advantage when it comes to salary of the PharmD as against the B Pharm. In fact, they do not even advertise for PharmD everywhere. In government, it's B Pharm that they recognize. So that is a major setback. So the last thing you asked was regarding whether there's advantage when it comes to job. I will give you two responses. Idealistic response and realistic response when it comes to the question. What I mean is this. So when the concept of PharmD was born, the students and the different faculties of pharmacy in various universities that train pharmacy students respond together, there was this issue regarding what advantage does this PharmD degree will have when it comes to job? Okay, what's their relevance with regard to job opportunity? And there are three areas we highlighted by then chairman of the Pharmacist Council of Nigeria, Dr. Adenika, and he mentioned that clinical pharmacists or PharmD pharmacists can work in hospital setting, in community setting. They can also work in industry setting. But this time their roles are specialized because they are things as clinicians. So you wonder, so in what setting, how can the clinical pharmacist work in the same setting with a big pharmacy but in a different role? So in the hospital setting, a Pharm pharmacist would be there for the purpose of ensuring pharmaceutical care. So offering pharmaceutical care, clinical pharmaceutical care in hospital setting. And that's a very important, very important aspect in healthcare, in hospital setting, which is being contended. And a lot of things are going wrong in patient care. In community setting, a family pharmacy could be employed so that it could heighten the medication monitoring for that facility, so as to be able to, like, I'll put up a form of research. You're ensuring that you're not just dishing out medications, you're not just dishing out drugs. There are people taking these medications, and you need to be able to track to ensure that they are getting outcomes. It's easier to track within a hospital facility compared to a community pharmacy setting here in Nigeria. So, but that's a very important role where if you have a family pharmacist employed for that purpose, that pharmacy will be able to have medication monitoring done very well in that facility that will ensure things go right and is a source of data for research. And in the industry setting, a family pharmacist can also be employed to be able to build relationships. One thing about the family thing, so it appreciates so much. I don't know, maybe that's the reason why this competition it taught us to be very confident in ourselves. We're taught, amongst other things, managerial skills and communication skills. So if family pharmacist is able to build network, is able to network with other healthcare members, so in the industry setting, it will be a better health team player in that setting, and what into drug research in industry setting. So advantages and then the specialized role for some the pharmacists in this different settings. I hope I answered the question.
That is very explanatory. Thank you very much, Dr. Opara. In summary, yes, the FAMD program has some advantages over the FAMB program, and I think from what you've just explained, pharmacists in general should go for this FAMD program so that we can gain more relevance in our field. Thank you very much, Dr. Opara, for shedding more light on that. So please, for the sake of time, we'll just try and be running up right now because we are almost we've always gone beyond our target. We actually budgeted 1 hour 30 minutes for this program, but we seem to be having a lot, and I'm sure if enough time is being given to us, we would go on and on and on. There is a lot to talk about pharmacy practice in Nigeria. That's the more reason we'll be having this panel session in subsequent times, so that we will shed more light on the thing we haven't touched in this session for today. So to wrap it up right now, I'm just going to ask Pharm Omotoyosi, please. I don't know if she's still with us. How are you still
Yes,
with us?
please.
Okay, so just
Yes, please.
this very last question for the panel session for today. Then Ruth will be running it up. So for the very last question for you, pharmacist Omotoyosi, what are the basic steps that should be taken by every pharmacist and intending pharmacist, irrespective of your area of practice, towards the advancement of good pharmacy practice in Nigeria? I can take that again. Like, we've discussed and we've finished discussing all what we did. So now, what are those basic steps in summary? What are those basic steps that pharmacists can take, as well as the intending pharmacists? What can they do? What can they take to advance good pharmacy practice in Nigeria? Just a summary of what we've been talking about the whole of today. Thank you.
Okay, thank you very much. First off, I would like to say that there is an article by the World Health Organization. I have it. I don't know if I could send it to Ruth to send it to everybody, because you cannot walk by something if you don't even know what it entails. There's a standard, there's a good pharmacist practice that's put together by WHO. That it contains everything that we're supposed to know about good pharmacy practice. I feel like every pharmacist should actually read it. So you know what you are working with, you know what you are working by, you know how far you are from the standard, you know how much you have to come back to the standard. So yes, please, first off, check that out. Number two, pharmacy profession is a very nice profession, but don't do it for the money. Don't come into pharmacy profession for the money. Yeah, the money will come, but don't come for the money, because you might be shocked and it might just affect how you see the profession. would not also like to, would not pretend and say that we don't know that a lot of people that actually end up being pharmacists wanted to be doctors, but maybe could not make the cutoff or something. So your mindset is even not, it's not as if you are really, really interested. I want you to develop a passion for this profession. I want you to love your patients. If you see that patients as it's my responsibility, you give your all to it, you'll be an exceptional pharmacist. You try to be a leader. Let pharmacists take one thing that I think we missed out today, and I think Taiwo is in the best position to talk about that is policy making. A lot of pharmacists are not in the places where we make decisions, and it starts from when we're undergraduates. Yeah, they're so concerned. Pharmacy school, pharm chem, pharmaceutics, everything, clinical pharmacy. I want to just do my test, and we don't get involved in making decisions, and eventually, when we come out into the practice, it really affects us. We have to be where the policies are being made. We have to be able to standardize the professions. We have to be able to raise up our voice and stand tall and set examples. Just because everybody is doing it like that doesn't make it right. Yeah, you could be an example of that one different person that is doing it the right way. The life of a patient can be saved because you are doing it differently. Just because everybody is doing it and everybody just wants to make money and everybody just wants to milk the profession does not mean you have to come into it to milk the profession. The profession is a very desirable one. It's a very noble profession. It means that we have to act as noble men. We have to stand out. We have to be exceptional. We have to care about our patients. We have to know that this thing is it's not really about me. It's about the service I'm offering to humanity, my contribution to society. It has to be pharmacists stepping up their games and learning, giving themselves to active learning, giving themselves to research. How can we do this thing better? As a pharmacist, you have to be a manager, you have to be sound in your drugs, you have to be sound in human relationships, you have to be a lot of things to a lot of people as a pharmacist, yeah. And that's what's going to make our profession and our practices stand out. But like I said in the beginning, please know what the practice is so that you know what you're actually supposed to do. So okay, this is what is expected of me. This is the good pharmacy practice that I'm supposed to practice, and this is what I'm supposed to do. So please, I'm imploring us, especially young pharmacists. We're still very young. The system has not really gotten into us that you can make a difference. You sure can make a difference. Everybody's doing it doesn't make it right. You can stand tall and dare to be different. You can decide to say, this is my profession and I'm not going to mess it up. You're going to say that this is what I'm supposed to do and I'm not going to compromise because of anything or any circumstance or situations that surround me. The system might be failing, but I'll contribute my own quota. Everything might not work out, but I'll make sure from my end there's no fault that's coming from my hand. And that way we're going to be able to, help the profession to move forward and maintain good pharmacy practice. Thank you very much.
Wow. That is my starting conversation. Just wow. I want to say a very big thank you once again to pharmacist Toyosi, Taiwo, Blessing, Dr. Opara, let Opara. You guys have been, you've set this place on fire today. And this is the why, right? This is the why we're putting this panel sessions together so we can talk about these issues, right? And moving forward, we're also going to be talking about solutions as well, like solutions that we're going to prefer, because it's one thing to go on and on and on about issues, right? And it's another thing to come up with solutions that we can start to work towards them so that we can move on, from the problems that we're seeing and start to have a better practice, right? And I have some points here that I would like to share. I'll be very fast with it because I don't want us to go past 2 hours with this session, okay? And like I have here, see, we know that we have issues in the practice. That one is certain, right? But the first thing that I have for everyone that is listening right now is mindset conditioning. Okay, you need to condition your mindset, just like Pharm Toyosi said, condition your mindset that regardless of the situation, which can be really challenging, I tell you that, especially if you're coming from a place where, and that's probably like the majority of the population, where you're working so that you can fend for yourself, so that you can fend for your family, in combination with the fact that you enjoy being a pharmacist, yeah? But at the same time, condition your mindset that regardless of the situation, you're going to give your very best, right? You're going to give your very best, and paying attention to details. Because as pharmacists, especially you that you're in clinical, in the hospital setting, there will be times when a physician could make a mistake. That's normal because they're human beings. But as pharmacists, we're the person that was supposed to catch these medication errors, right? So paying attention to details. And by the time you start paying attention to details and you're giving constructive feedback, that's also something I wanted to say, because as young pharmacists, right, it could be constructing our thoughts in a way that is respectful, and then we're giving a constructive feedback could be a challenge, but then learning how to properly communicate. And in that regard of communication, I have something that I want to share with us, something that I've learned, and I really want to share with us, everyone here. And it's what we call S-bar communication. That's something I'm learning in the Pharm program. This is how you communicate your mind to another healthcare professional. This is how you see a problem, you see an issue, right, with the patient, and you want to tell the healthcare provider that, hey, this is what is going on. The first thing that you start with is, who are you? Who are you in the first place? You're coming to a physician, regardless if you have a relationship with this healthcare professional or not, you're identifying yourself. Hey, my name is so and so, and then you explain the background situation. What is going on? What is going on with this particular patient? You explain that. You give a brief assessment of what is going on with the patient, and then you share your recommendation. And that is what we call constructive feedback. You're not just saying, I think we should do things this way. Why should we do it that way, right? And you're coming up with solid recommendation. You're giving resources as to why you're sharing this recommendation. For instance, I'll give you an example. There have been times when a patient will come to the pharmacy and their insurance, because we have insurance plans here, their insurance cannot cover the medication that they're bringing into the pharmacy. Or it could not even be an insurance issue. It could be because a physician made a mistake, made an error in prescribing a medication that the patient is allergic to. Now, how do you handle that kind of situation? Being respectful, giving a constructive feedback, right? You explain this, tell the physician who you are, tell the healthcare professional who you are, the person that recommended the medication. You explain the background. Okay, this is your patient. Do you remember this patient, right? And you recommended this particular medication, but apparently the patient has an allergy to this medication, and because of this, we don't think it's best to give this patient this medication, but I am recommending that this other medication will be better because I've checked my sources, because we have different books that we can refer to as pharmacists, right? So as you're having this kind of conversation, let me tell you, the healthcare professional that is listening to you can automatically know that you're coming from a sound background. You're not just spitting words out there, but you're very, very constructive. You're orderly in the way you present your matter. And whether you like it or not, respect is going to follow suit. Okay, so in our communication as well, it's vital that we communicate the right way. And in line with communication as well, because I know we have the issue of electronic medical records in Nigeria, which is something that we're working on. And hopefully, like with this project and moving on, we can have like a better result with that. But in the meantime, how do you ask a patient that is in your pharmacy the right questions? Because asking the right questions also matter when you're answering the questions of a patient, right? So they come to you, they ask you, I need paracetamol. Why do you even need paracetamol, right? What's the point? What do you need it for? What is bothering you? What are the symptoms that you're experiencing? What are they like? And that's what we call like Scholar Mark, which is something that we use in every community pharmacy here in the United States. When a patient comes to the pharmacy to ask a pharmacy-related question, a medication-related question, you're Scholar Marking them. That's what we call it. And the S is like, you're asking, what symptoms are you experiencing? Explain the characteristics of the symptoms. Say you have boil. Okay, how long has that boil been happening? Have you had the boil before? When did this start? Where are you experiencing the boil? Trying to get insight on the location. All right, what have you tried that has made it worse? And what is making it better? Just asking the right questions. Asking the right questions will also help as we're working towards being better pharmacists and improving pharmacy practice in our little way, even as we work from the ground up, okay? And another thing that I have here is, yes, I know we talked about we don't have enough pharmacists, and that's actually an issue, because if we don't have enough pharmacists to do the work, then quality will be in question, all right? So, but even at that, with the little number that we have right now, if every Nigerian pharmacist that is in Nigeria is giving quality work, right? You're doing quality work, you're giving value, there will be a difference, regardless of how small the number is. And the good thing is, as people start to see the value that we're giving, more people will be interested, more people will want to join the practice, because I've heard and I've seen pharmacists that are taking up other professions because, I mean, there's no interest. They were not building enthusiasm. I mean, you've seen how enthusiastic our panelists are. They're very excited to talk about the issue of pharmacy practice. They want to be great pharmacists. And I'm imploring everyone that you have that level of enthusiasm. You want to be the best pharmacist out there, right, in Nigeria, that someone can look at you and be like, whoa, if that person can practice pharmacy like this, I also want to be like that and even be better, right? Because like I said in the beginning, the background of this project started by watching a Nigerian pharmacist do a great job practicing good pharmacy practice, giving compassionate care to patients, all right? And yeah, so I know we're also talking about some people, you have options as a pharmacist. You have options. You don't have to stay in a particular place if you're not given what you want, right? Pay-wise, responsibility-wise. But then, if we're being realistic, there are some people that they can't say no to an offer, probably because, like I said again, they have responsibilities to take care of. Now, how do you handle that kind of situation if you're one in that situation? The first thing I would say is, yes, you might want to take the offer, but keep building yourself, even as you're working there. Keep building yourself, like a lot of people have said today. Keep providing value, and while you're doing that, be applying to other places, okay? Because as you're improving yourself, you're improving your portfolio as well, and then you apply to other places so that you have more opportunities where you can get better pays and better responsibility that fit into what you believe that a good pharmacist should do, right, in the pharmacy setting. And we talked about the PharmD program, and honestly, this is something that we will be pushing, through the TCPPP project, because having a PharmD program and having that PharmD degree is a great tool, and it helps your clinical orientation as a pharmacist, yeah. And I've been talking to my colleagues that were working together on this project. I've asked questions as in the community pharmacy setting, yeah, we should have exclusions to care that we're given. Not everybody that comes into your pharmacy you should recommend a medication to them. There are some patients that they come to your pharmacy and you just refer them straight up because they are not the right candidates, right? Are we even talking about exclusion criteria? So these are things that we need to start thinking about. And like from Taiwo, I said, give yourself to learning, because there are some things that will never be taught in school. And that's just the fact of the matter. Some things you will never hear them in school, but because you're giving yourself to continued learning, right, continuous education, you're learning more about the industry. Be enthusiastic about this profession, even if the university that you're in, they gave you the course, because that's also a thing, right? They gave you pharmacy and you're studying pharmacy because of that. But as much as you can, be enthusiastic. And if you can't be enthusiastic about the profession, honestly, as harsh as this might sound, you don't have to be in the profession. You can find other professions to embark on, because the thing that we don't want to happen is having people calling themselves pharmacists and they are not willing to provide patient-centered care. That's not something that we ever want, all right? And another great benefit of the PharmD program is that, especially here, and something that we're going to be pushing moving forward as well, is with the PharmD program, you get exposed to clinical rotations early on. So you see the issue of like other healthcare professionals not respecting us as the drug experts. If you're exposed to working with them early on, and even without the PharmD program, it is your responsibility to reach out to these people, connect with them, right? Build relationships, build collaboration, for the sake of your patients, for the sake of your profession, all right? And in conclusion, the panelists have said a whole lot today, okay? And in conclusion, I just have two things to wrap up this conversation. And it's, if you walk into a pharmacy today, right? If you walk into a pharmacy today in Nigeria, I'm sure you would love to be properly taken care of, right? You would love that your questions are properly answered. I know we fancy pharmacy practice in other countries, right? But we can also bring that into Nigeria. We can inculcate all the standard pharmacy practice, which we have, by the way, from Toyosi, because you mentioned it. We have the document at TCPPP, and I'm going to be sending it when I'm sharing this meeting recording with everybody, right? Making sure that you know the kind of standard that you want for yourself. If you visit a pharmacy, then why not be that kind of pharmacist, right? So be that pharmacist that you want to see in other people, right? And be extremely good at what you do, to the point where you become a point of reference in the profession, and patients, they feel safe with you, because at the end of the day, the whole point of this conversation, once again, is good pharmacy practice, which is centered around patient-centered care. You're giving quality care to your patients. That's the bottom line of this conversation. Whether you're talking about research, whether you're talking about health and the hospital setting, community, policy making, everything ties into that one thing, which is ensuring that we're giving the patients the best quality. We're giving them quality care. And what is quality care in our line of profession? GPP, right? So I'm going to be sending out this document so you get familiar and understand what we're even saying. Maybe you're not clear on what we mean by good pharmacy practice. Read this document. It's like a 10-15 page document, very well spaced out, right? Read it, understand, know what is expected of you. And in future panel sessions, we're going to be deep diving into policy making. We're going to be deep diving into other aspects of pharmacy practice, so that we can have an informed understanding. And beyond the panel sessions where we're asking questions, we're also going to be having information sessions as well. All right. And yeah, I'm going to stop here for now. Once again, thank you guys for joining. For every participant that has joined and stayed up to this point, I appreciate you. David, are you there? Can anyone hear me?
Yes, you can hear you.
Yes, we can.
Yeah. Ayanfe, do you want to say something? Okay, David is here. I think David is here. Okay, David, before you go ahead, Dr. Joy, do you want to say something? And then we'll wrap this up.
A very quick one.
Okay,
I
I'm in.
think, I wouldn't forgive myself if I didn't mention a very important that concerns informative in relation to my current area of practice. Like you heard, well, I'm a lecturer in the department, pharmacy technician department. So I just wanted to highlight that we can be talking about good pharmacy practice if we forget that we have pharmacy technicians who have been trained to also assist in carrying out pharmacy-related functions. And one of the challenges I'm having, or we're experiencing here in Nigeria, is even many pharmacies do not understand the relevance of pharmacy. They rather use sales boys and girls in their pharmacy practice. This is especially pharmacy practice, because pharmacy technicians are employed by government. Pharmacy technicians are employed by the government in government institutions. But pharmacy technicians are not really well known. Among pharmacy students, they are the concept of pharmacists don't know. And so that's a big problem or big challenge to in Nigeria. So I'm going to say this is further what we are having right now
no,
in
everything this woman did.
So many things they have no relevance in community pharmacy settings. I had a student of mine who was to go to IT, normally post out students of IT, and they came back saying to me that she was given away by the pharmacist, the MD of the pharmacy, doing in community pharmacy. So
Dr.
I think it's
yeah, we couldn't hear you very well, but I think from the little bit that I gathered, I think you're talking about the relevance of pharmacy technicians. role in pharmacy practice as well. And yes, that's also, yeah, that's a conversation we're going to be having as well, because it is vital. And I'm not sure who brought it up. When you have sales people that have little or no understanding about the medication that they're even giving people, then the counseling will be it's literally zero, because they know nothing, they don't know much about the medication they're dispensing. So yes, we're going to have conversations centered around the role of pharmacy technicians in improving pharmacy practice in the country. We're going to be having conversations centered around that as well. David, you can go ahead now. I think you can. We can't hear you.
Yeah, good
Yeah.
evening once again, everyone. Thank you so much. Thank you for joining us on the discussion today. Thank you so much, everyone. Thank you, Dr. Joy, pharmacist Omotoyosi, pharmacist Taiwo, pharmacist Blessing, let me call them organizers, Ubere and Agbola. Thank you, everyone. Thank you, everyone, for showing up. Thank you so much. We look forward to many more engagements like this. It's for the betterment of ourselves, betterment of our nation. And
Yeah, I think his network is.
so may God help us. Thank you, everyone. Thank you so much. God bless you.
Amen. Amen.
Amen.
Yeah.
Thank you too.
That's awesome. Thank you, guys. Honestly, I can't thank you enough. This is amazing, and we're looking forward to doing more of this. And I'm going to be sending out an email with a contact form. In that email, you're going to see a contact form where you sign up to be a part of this project, because like I said in the beginning, this is a nation building project by Nigerian pharmacists. It's not a one-man thing. It is our thing. All right. So please, when you get the email, do well to sign up, fill the form, and let's do this work together. All right. Thank you very much once again. If you are part of the people that organize this, please stay. Let's have a conversation. But aside from that, you are free to go. Thank you very much.